Hello. I am doing my outro project with Miss Amber Lead Kelly. She works at Bergen Mercy, and she is the community outreach coordinator. And here she is.
Hi.
Yeah, we're doing an outro project, and this is just showcasing some program that has shown a positive impact in the community. So I did say give you a couple of questions, so you can just feel free to answer some of them.
Okay.
Yeah.
So you want me to just start? Okay. So one of the questions is briefly describe your involvement as the outreach coordinator with Allegiant Creighton. So just to give you a little bit of background as to why the Cancer Center even has a community outreach coordinator. We are accredited by the American College of Surgeons Commission on Cancer. They accredit community and also NCI comprehensive cancer centers across the country. They have 12 standards that you have to meet, and one of those standards is prevention and early detection. So we are required through that standard to provide prevention activities and then screening for the community. And then also recently they've added you have to do a community needs assessment so that you make sure that you're reaching out to the population or parts of your community that need it the most. So and we've already, before that even became a standard, we were offering that. So that's why we have community outreach. So there's a couple of areas that I address in addition to prevention and early detection. I also help coordinate our patient education for our cancer patients. We have a lot of in-house materials that we print and produce, and then we also work very closely with the American Cancer Society and the Leukemia Lymphoma Society and the NCI to provide materials for our patients. So I coordinate. We have our own committee that meets, and we look at any new materials, any new videos, anything that we want to offer for our patients. So, and like I said, we work closely with our partners for that. Then we also do a lot of sponsored events. Because we have so many other nonprofit organizations that serve our patients, we help them with their fundraising. So like with the American Cancer Society, they have Relay for Life. Coleman has Race for the Cure. And so we sponsor those events, and then we also get teams to help participate. So I cover that as well. Another piece that I cover is professional education. We offer a monthly program for our staff that offers CEUs for nursing, social work, radiation therapy, and our cancer registrars. So we host that once a month as well. And then I also do a little bit of marketing PR piece as well.
Okay.
So
yeah,
hopefully that answers.
Yep, it does. I saw that.
Okay.
Yeah.
What services does the outreach program provide? I think I kind of touched on that, but in terms of cancer prevention and early detection, I can just give you some examples if that will work. For prevention, one example, we got a grant from the Nebraska Cancer Coalition this past year, so last spring, to install sunscreen stations at Warner Park. So we know if you've been to Warner Park, there's very little shade. No matter where you sit, there's just a little narrow spot of shade there. And there's been, and it's an evidence-based practice that helping to have your environment support those behaviors for skin cancer prevention. So we've installed sunscreen stations that are free to the public, and the grant funding covered that. We also did some training with their staff so that their staff were more aware about their exposure and that they can use the sunscreen as well. Then we were also at the park about 3 or 4 different times with sun safety information and reminding people that came. These are here, they're free. If you forgot to bring your sunscreen with you and you need to reapply, they're here. So, so that's one example of prevention. For early detection, we offer screenings for breast, colon, skin, and head and neck cancer. The guidelines for prostate cancer screening have changed recently, so we don't offer those the Cancer Society really wants men to talk with their doctors before they're screened, to have that discussion about the risks and the benefits.
Yeah.
So on a limited basis, we do prostate. So for an example of colon cancer screening, a lot of my time is spent with coalitions, task force groups, other nonprofits that coordinate education and outreach. So we really rely heavily on our partners. Even the other health systems we work closely with. So for colon cancer screening, we actually have our own nonprofit task force that covers Omaha and Council Bluffs, and it's all the health systems, it's patients, survivors, the American Cancer Society, people that are just interested in early detection of colon cancer. So every March, which is Colon Cancer Awareness Month, we distribute fecal occult blood test kits through the local pharmacies in the area. So like Hy-Vee and Walgreens and all of those. And then each of the health systems, we take turns reading those kits, and then we follow up on all the positives as well. So that task force has been around for probably about 12 years. And we started it because when we looked at the data, we saw that screening for colon cancer in Nebraska was really low. I mean, we were like 48 out of 50 states. So, and we've actually seen, obviously there's more in the media and the press about it, but we've seen a big jump in the number of people that are getting screened for colon cancer, whether it's with an FOBT or colonoscopy or whatever. So we've really seen an impact as far as that goes. So
that's awesome. Yeah. So is there a particular target population that you are dealing with in the community, or is just everyone?
For that particular screening,
No,
do you
for
mean, or
just
just
outreach.
So when we look at our community needs assessment, there's of course folks that are higher risk for certain cancers. We one area in particular that we're starting to focus more on, when you look at the data for Nebraska for breast cancer, no matter what stage they're diagnosed at, African American women are dying at a higher rate of breast cancer. And they've been doing some work with that at UNMC. And so we've kind of, major stakeholders are coming together to look more closely at, why is that happening? At an early stage, we shouldn't see that. So doing some more work there. And then when you look at the data too, when you look at those that are in need of mammography screening, it's residents of North Omaha and it's residents of South Omaha. When we look at skin cancer rates, actually it's more western Douglas County, but that's still more of a farming community. So they've got higher skin cancer rates. So it really is looking at the data. With colon cancer, obviously that's 50 and older, but again, African American men and women are at a slightly higher risk. And also, we're looking at those that are uninsured, underinsured. So yeah, we definitely have targets.
And you provide all these services. Is it for free, or is it
when we do a screening, it's free.
It's free.
Yeah. Now, fortunately, there are a couple of state programs in both Nebraska and Iowa that if we sign, like with the colon cancer screening, if somebody has a positive and their insurance wouldn't cover a follow-up colonoscopy, we can get them enrolled into a program that will cover that. Or as a health system, we've just committed to say we'll cover that.
That's awesome.
If we need to. So. Where are we at here? Identify and describe how public health is positively impacted by this program. So this would be more of our outcomes and impact, do you mean, for public health? Well, I think I mentioned the colon cancer screening piece. I mean, we've seen, a big jump in the number of people that are getting screened. And as a result, we're seeing mortality decrease as well. We are heavily involved with skin cancer screenings in the community. And obviously, when you look also at the data, there's... when we look at cancer incidence overall, it's good, it's going down. But the one cancer that's on the increase is melanoma. And so what we, are hoping to impact there is that obviously prevention, but also with our screenings that we're involved with, we want to catch, if somebody has melanoma, we want to catch it early.
Yeah.
So we'll watch our registry data closely to see if are we catching those melanomas at an earlier stage. So yeah, I would say, obviously it's one of those things where it takes a while to see your results, as you know, in public health. You know, you can look at your participation rates, are you reaching the people that you need to reach? And I would say we are.
Yeah.
We've been successful with our partners to do
Definitely.
that.
And putting those sunscreens in that park.
Right, right.
Do you think that program can be extended to
That's
other parks?
other parks, and that's great because this is a really good example of another partnership. So I'm involved with the advisory board for the Nebraska Cancer Coalition on the Nebraska side, but because we serve the western side of Iowa, I'm involved with the Iowa Coalition as well. And they have probably about 5 minor league teams in Iowa. And they were working around the same time to get sunscreen stations in as many of those parks as well. So I said, hey, they're doing this here. Let's contact our park here and, see if we can do that. And of course, we want to see that sustained.
Right.
And, hopefully they'll see that there's real value in that. The fans appreciate it. They know they're watching out for them.
Yeah.
And, then invest in it themselves.
That's a great program, I think. That's
yeah.
really awesome. Yeah. Okay.
Okay. Can you identify different levels or ways of community engagement and participation?
I think you touched
Okay.
that. Yeah,
Okay.
I think you did.
How would this community outreach engage in collaborative problem solving and decision making? And I think, like I mentioned, we rarely are out there doing anything by ourselves. I mean, this is very much in a collaboration with, as I mentioned, the other health systems. I think some people find it pretty amazing that we work amongst the 3 health systems very well together. But you have limited resources, and you're all trying to do the same thing. So we work well together. We work with the South Omaha Community Care Council, the North Omaha Community Care Council, Black Family Health and Wellness. So, yeah, I mean, there's a lot of collaboration going on there and a lot of shared decision making. That things progress a little more slowly sometimes when you're in that situation. It takes time and patience, but I couldn't imagine doing it any other way.
That's awesome.
So,
yeah, that's good collaboration.
Oh,
We need that.
absolutely.
Yeah.
I think if people want to know how it's done, they need to come to our area. I mean, there's always bumps in the road, but this community works very well together, I think.
That's great.
So, yeah.
Nice to hear that. Yeah.
So what population in the community? I think
we
kinda
did touch
covered
that.
In what ways does this program discuss or address determinants of health disparities? I think with our outreach, as I mentioned, our screenings are free, and so we try to address the cost piece for folks that don't have insurance or underinsured or maybe don't have a primary care doctor and they need those services. So it's that access to health care piece. We try to meet folks where they are in the community to make it easy for them. Health literacy is becoming more and more important. So we're looking at, we've got great education materials, but oftentimes they're at a 12th grade reading level. We find that pictures work better for people when it comes to education. So being more in tune with that health literacy piece as a determinant of health.
Okay.
So
That's good.
does that cover
Yes.
that? Okay.
Yeah, it does.
Describe methods and regulations that the program is associated with public health practice in relation to diverse population. I mean, we work very closely, with our diverse populations, those populations that are at a higher risk, and get them involved as much as possible. So it's not just us bringing the program to them and say, we built it, you need to come.
Right.
It's what are your needs? How best can we work to meet those? So we always try and involve community members.
That's great.
In our efforts. So identify and describe the public health careers involved. So would this be like
You,
people, so
yeah.
me and the people I work with, and so my background is I have a master's degree in health education from UNO, and then shortly after that I went on to get my CHES certification. So I'm a certified health education specialist. So that's my background. So in terms of other people that I work with in the community, nurses, social workers, public administration. Obviously, when we're doing screenings, we have healthcare providers involved, so PAs, NPs, family practice, OBGYN, colon and rectal surgeons, so that whole gamut there, working on public health as well. Obviously, some folks more in an administrative area, but then like those of us, I always say, that are on the ground out there in the field. So, and then obviously, you know, when we are with our programming and our events, I've got our staff involved as well. So that's oncology nurses, radiation therapists, our oncology social workers, and then we have our cancer registrars as well.
Nice.
So there's a variety there too, just getting them involved. So those are kind of the, I guess, different careers that, and you know, even epidemiologists are involved in some of the different projects, especially research-based projects that we've worked on too. So, so where can people in the community go for additional information or resources? So are you referring to that more cancer-related information?
More cancer-related,
or, okay.
And how do they, I think I was trying to say, how do they know about this program? And
Okay.
how can they
access that?
access that information?
I can't say that we have any one place where they could go. I mean, it would be, you know, through our partners,
Right.
that people would find out about it or access it. Like, you know, different screening events are often tied, like we do a large screening event for women in the fall that's tied in with Binational Health Week. So the folks that are planning all these activities for Binational Health Week are going to they'll have their website available, they'll have their phone numbers out there, you know, flyers everywhere, information. So accessing it that way, or it could be through the community health center. We've got information there that people can find out about it. We get a lot of great radio support from the newspaper. A lot of it is word of mouth too. I mean, one person will find out about it, and they'll tell everybody else, and find out that way. So
Awesome.
I'd say a variety of access points there.
Right.
So.
Yes. Well, thank you so much, Amber Lee Kelly. I really appreciate this. This was such a informative interview, and keep up the good work. Thank you so much.
Thank you.